surgery should be the last treatment option for adults with scoliosis and should only be done when non-surgical treatment options have failed. Unfortunately though, many adults with scoliosis believe that pain medications or treatments like injections and possibly surgery are the only treatment options they have. But the reality is, non-surgical treatment options have the same goal as surgery, which is to reduce pain, stop curve progression, and enhance quality of life. And the research is clear. Scoliosis-specific exercise and custom bracing are effective at slowing curve progression, decreasing pain, improving posture and balance, and potentially reducing the likelihood someone actually has to have surgery. And the older you get, the higher the risk of complications associated with surgery. So let's actually take a look at some of the risk associated with getting a scoliosis surgery in adults. So complication rates with adults with degenerative scoliosis are about 50%. So 50% of adults that have surgery for degenerative scoliosis have some type of complication associated with that procedure. 30% of patients who undergo spine fusion for adult degenerative de novo scoliosis require a readmission within just 1 month, and 12% of patients require an additional surgery within just 5 years. But that's not all. What are some of the other risks associated with surgery in adults with degenerative scoliosis? Well, there's the risk of neurological injury, possibly a spinal cord injury or injuring a nerve root. Degeneration of the adjacent segments, known as adjacent segment disease, because all of the spine is designed to stay in movement, and when you fuse a section of the spine, the joints above and below that fusion have to make up for all that movement, and they tend to break down and decay at a much accelerated rate. Infections. Infections is one of the biggest potential complications or risk of getting a surgery. And then also, just continuing of the curve progression. Just because someone has scoliosis doesn't mean their curve won't progress. In fact, a lot of times a secondary curve will develop or progress because you fuse a section of the spine. And then as previously mentioned, the potential for having additional operations. 12% of anyone that gets a spinal fusion with degenerative scoliosis has a new surgery within just 5 years. Now, when you look through the research, the evidence is also clear that adults are more likely to get the best outcomes when we treat scoliosis early on in adulthood, when curves are more flexible and they have less degeneration, compared to when people are older and there's more severe degeneration and the spine gets stiffer. In fact, let's actually look at a case with an adult that developed scoliosis in adulthood and they didn't get the right treatment, and let's look at how their curve progressed. So this patient actually presented to her primary care doctor at the age of 48 years old. She was told she has no scoliosis, she was prescribed pain medications, and just told that there wasn't really a concern. This was actually a nurse to make it interesting. When you look at her spine from the front, you really don't see anything developing on here. One thing we do note here, that there is a loss of curve, which if you watched it in my other videos, that's a risk factor for a curve progressing. Well, this is her 9 years later. And in 9 years, now you can actually see this scoliosis starting to develop, and you can see an increased worsening. So she was 57 years at this time. Now, an important note, she actually went into menopause at 52 years old, and menopause is actually a time when adult degenerative scoliosis tends to develop, or an adolescent scoliosis tends to progress more rapidly in adulthood. Well, to go from here to here, this is 2 years later, and now you can rapidly see her curve progressing. And now you see some lateral aesthesis, the bone is slipping off, and you're getting more severe degeneration. If this curve would have been treated properly, this might not have happened. Still at this point, she had no treatment, and then just 1 year later, it progressed even further to here, still with no treatment. And so at this point, I don't know what happened with her. She didn't do anything, but this could have been prevented if she would have got treatment earlier on in those earlier days when the curve was still really small. Now, if you're watching this video and you have not already downloaded our free guide in adult scoliosis, be sure to look in the comment section below, click and get that free download. Now let's take a look at some of the most effective non-surgical treatment options for adults with scoliosis. Now, one of the most conservative options for adults with scoliosis is actually scoliosis-specific exercise. And in fact, this paper right here looks at the effectiveness at severe scoliosis in adults just doing scoliosis-specific rehab. Here's what they found. After 2 years of doing therapy or the treatment, 74% of the patients improve the overall measurement of their scoliosis. So 74% of the adults with severe scoliosis had an improvement in their scoliosis just from doing scoliosis-specific exercise. So what this paper confirmed is that when patients with adult scoliosis that is progressing, scoliosis-specific exercises can be effective to obtain stability and in some cases to reduce the Cobb angles. In highly progressive curves, exercise appeared to slow down the progression of curves that are warping at a rapid rate. So we know scoliosis-specific exercise can stop curve progression, in some cases reduce the size, in the most aggressive cases at least slow down the progression of scoliosis. So in the article I talked about patients with adult scoliosis that's progressing, scoliosis-specific exercise is effective at stabilizing the spine and in some cases reducing the Cobb size, or reducing the severity of the curve. And in severe cases that are progressing rapidly, slowing down the rate of curve. Their conclusion was scoliosis-specific exercise. C stands for scientific exercise approach to scoliosis, which is one method of scoliosis-specific exercise that we incorporate into ScoliBalance at ScoliCare, proved to be superior than natural history, which means it's far more superior than doing nothing, and should be considered a first-line treatment, especially in patients that are readily refusing surgery. Now, other than scoliosis-specific exercise, another effective treatment is actually custom bracing. Now, this is a great paper that actually looked at the effectiveness of bracing in adults. And what I love about this paper we're about to go over was they looked at patients over a 15-year time frame. And during the first 10 years with no treatment, the average patient's curve got 15 degrees worse, or 1.5 degrees worse per year. And then they had them wear custom braces for about 4 to 6 hours a day. And with wearing a custom brace just 4 to 6 hours a day, the average curve only got about 1 to 2 degrees worse, or 0.1 or 0.2 degrees worse per year, just from wearing a brace 4 to 6 hours. Let's take a look. So in this study, we have two different types of scoliosis. We have degenerative scoliosis that actually developed in adults, which is more aggressive. And then we have idiopathic scoliosis. This is the scoliosis someone had when they were younger that they still have as an adult, but the curve is progressing, getting more severe. So over here, you can see this is the severity of the Cobb angle, or the curves getting worse. The black line is actually their curves progressing before they started wearing a brace. So you see it progressing gradually. And over here, the curves are progressing more severe. And then right here where you see it change from black to light gray, that's when they started patients wearing a brace. And where you see the line drop down, that's because the curves improved. So in all of these, you will see the slope or the rate of progression decrease, and in some cases, the size of the curve actually decreasing. So what they found in the paper is that for the first time to their knowledge, that custom braces or custom molded lumbar sacral orthosis, which is basically a custom scoliosis brace, showed effectiveness in slowing down the progression of adult scoliosis. And they say considering the limited side effects, it represents an interesting treatment option and an alternative to surgery that is associated with high rates of complications and other technical difficulties, especially in older populations. Their conclusion was that custom molded lumbar sacral orthosis or custom braces are effective in slowing down the progression of adult scoliosis, and considering its limited side effects, bracing should be proposed as a first-line treatment in association with physical therapy. It represents an acceptable alternative to surgery in patients who cannot or do not want to be operated on. So look at that, it said it's a first-line treatment, which means we should do this first before resorting to surgical options, especially in patients that do not want surgery or cannot have surgery. Now, we know that custom bracing and scoliosis-specific exercise can be effective on their own, but what about when those things are combined? Let's take a look. This is a paper that actually looked at the effectiveness of adult scoliosis treatment combining brace and exercise. And in this research project, they actually had the patients doing scoliosis-specific exercise followed immediately by putting on their scoliosis brace. Now what they found was 68% of the participants had no pain or zero pain after doing the treatment. 67% had improvement in their posture and appearance. 53%, over half, had a reduction in the size of their curve, and they concluded that a combination of brace and exercise yield excellent results. Most improvement was achieved using exercise and bracing. So there you have it. Those are the most effective treatments for adults for scoliosis outside of surgery. We have scoliosis-specific exercise or rehab. We have custom bracing. And when we combine those, we know we get the best results. Now that you understand the most effective treatments for adults with scoliosis, where do you actually get those treatments? Now, if you're an adult and you have scoliosis, I'm going to encourage you to request a free discovery call. And this is a chance to talk to me for 15 minutes about your individual case. I can review your x-rays with you over the phone. I can let you know what your risk of curve progression is, and I can tell you what treatments you're likely a candidate for. Now, if you're actively looking for treatments and you want to learn more about ScoliCare Denver, click on the next video and you can learn more about scoliosis treatment at ScoliCare, the world leaders in non-surgical scoliosis treatment.